Penny has covered most everything, and I'm just going to add some things from a physician's point of view to help with coordinating care. Sorry? Mic up, okay. I'll talk louder. And this is Penny's slide. It's also really important to take care of you. And while we said, you know, your presence is very important when your family member's in the hospital, you need to sleep too, because the last thing we want is to have two people in the hospital, which can happen. If you wear yourself out, you're not doing your family member much good. So have someone you can swap out with or change out with, and make sure your cell phone number is on the white erase board. But you've got to get some sleep too. And many hospitals have a pull-out bed or couch or something that you can stay with your family member and get some sleep. But remember, sleep is important for you too. So when you go about picking your team, and as Penny pointed out, that can be different for every individual and cover a vast number of specialties. Don't be afraid to network and talk with other people in the community, because they might know who they've liked, who they didn't like, who they've already broken in. Because if you get a doctor that they've already educated, you're way ahead of the game. And once you found that doctor and they start being a magnet for myotonic dystrophy, they're going to start learning the wide array of symptoms that it can cause. And when they learn about the variety, they'll start thinking about those possibilities. And don't be afraid to interview your doctor. I wanted to empower you about this. You interview the people who mow your lawn and the people who babysit for you. You should be able to interview your doctor and decide if this is someone who matches with you and you want to work with. And I also wanted to give a shout out for teaching institutions. This is how we're going to make things better for the next generation. You're training somebody who is going to have a lifelong interest in myotonic dystrophy if you catch them when they're a resident. And the other beauty is that residents are wonderfully open to reading and researching and taking ownership of a particular problem, and you will have two people to go to. The resident who's going to be energetic, young, and enthusiastic, and your seasoned attending who will be backing them up. So you get a 2-for-1 by being at a teaching institution. Ask questions. There's nothing that's going to make your doctor go to the library faster than asking them a question they don't know the answer to. And medicine is lifelong learning, and this is part of their daily life and process. But also let them know, I'm going to the Myotonic Dystrophy Foundation conference this weekend. Do you want to hear more about it? They might not be able to go, but they might go to the website and pull down a talk or two or look up something they were thinking about. It gets them more engaged. And then ask them to call your myotonic dystrophy doc with questions. We don't mind. I would rather field things early than get caught behind the 8 ball, days or weeks later after a complication has happened. There's no such thing as a stupid question. Every question has a first question. That's how you learn things. So have them call us if there's something that doesn't feel right or they don't feel comfortable with. And then go ahead and bring in websites. I don't mind if you bring in, I saw this on the article or this supplement or that study. It might introduce me to something I didn't know about before. And so that can be really valuable. I wanted to introduce the idea of a medical home. And when Penny and I were going over these slides, she said, yep, my home is a medical home. And that's true, but it also is starting to mean something different. This is becoming almost a policy or a model of care that is being encouraged by Medicaid and Medicare as a way of preventing complications, of taking care of people at home, preventive medicine, preventing complications, keeping people healthy. And this is becoming an increasing priority in managed care groups as well as Medicaid and Medi-Cal. So the other thing I wanted to emphasize is you should try to bring somebody to your visit, to be a second pair of ears. It can be a family member, it can be a friend, it could be a patient advocate. This is something that they do on a recurring basis. I also encourage you to bring your LAR. You might not have heard of what an LAR is. An LAR is your legally authorized representative. This is the person who's the go-to person if you can't speak for yourself, if something happens. The person will be asking what you would want us to do, and if they're not there with you at your doctor's appointments, they might not have thought about or heard the discussions that are going to be important for that. So be prepared when you come to your visit. Some doctors only have a 20-minute chunk of time blocked out for a return visit. It's unfortunate, but it's often true. So be ready with a list of questions that you put together the night before or the week before, and put down anything that's different from the last time you were there. Put down the things you're worried about. Put down the things your family is worried about, because they might be worried about things that you don't think are terribly important, but you should probably bring them up. And then circle the most important thing. This is where we're going to start. This is what we want to cover today. This is the not miss. So if you only have a short visit, where do you want to start? And don't save the best for last. I know it's hard to bring up certain things and talk about things that are personal or emotional or embarrassing, but practice in the mirror the day ahead. I'm going to ask about, my constipation, or about this problem, or why is my hair falling out, or the things that you are afraid of asking a doctor. To practice asking that. If you can't cover everything in one day, if that 20 minutes isn't enough, ask for a return. Come back. Say, we didn't get everything covered. I really didn't get a chance to talk to you about that important thing that I couldn't get to today. Can I have a follow-up visit earlier than later? And often you can get that to happen. And then you want to get the most that you can out of the visit. And studies have shown, and Dr. Day's description of the multisystemic nature of this disorder, there's a lot to cover in order to ask what is going on with me. There's 54 topics if you think about it in a very itemized way. How are you going to cover that in a follow-up visit? Well, Cynthia Gagnon in Canada, and this is on the MDF website, has put together a very nice list, which is, yes, in medicalese, but if you can print this and take this to your doctor and say, these are all the things that we should cover and to ask through. And this is what we call a review of systems. It's the top to toe questions. How have you been since the last time? Are you having any problems here? That might uncover something important that you might not have thought of as on your list of the day-to-day problems. And then getting your medical records, bringing a binder or a folder or whatever your organizational plan is to bring it with you to the visit is really important. But it's also really important to get the stuff to your doctor ahead of time. So if this is your first visit, it's a new doctor, a new cardiologist or endocrinologist, it gives them a chance to leaf through things the day before. They may say, oh, I didn't know this was a problem in myotonic dystrophy. And they'll have a chance to look it up before instead of after. So getting your medical records there before the visit is really, really important. And even if you sign an electronic medical record release, it may not go everywhere to everyone. It depends on what electronic medical record a hospital or a system uses. They may not all communicate freely, and there's some things that are still locked behind walls, even if you sign that, sure, share my electronic records. And then you need to fill out one of these forms. It's called a release of information form or a release of medical records form. And this is required by the Health Insurance Privacy and Portability Act, or HIPAA. So you've probably heard the word HIPAA, but you might not know what it means. But this basically is a requirement that you give permission for any of your doctors to share information between each other. And it is for your privacy and the safety of your medical information, but it can also become a barrier in communication, and we don't want it to be that. So the more information you can put on this form to get us the records we need, the better it is. So don't just say, Dr. Smith saw me since I was a kid, please send all my records, because then you get a pile that's 3 inches thick, and it's all of your flu shots for the last 20 years and well baby visits. If you say, Dr. Smith did an EKG on me 2 months ago and something wasn't right and that's why he's sending me to you, put down Dr. Smith, within 2 months, specifically send that EKG. And that will help your doctor get the stuff that he needs. So be as specific as you can. Also, put future dates. So some of these will expire in a year or a certain amount of time. So you can specify, I want it to expire in 2080 or something like that. And so that means that in the future, I can still ask Dr. Smith for other information. Patient portals. So these are becoming increasingly popular. There's some really great aspects of this. You can get an appointment. It can remind you of your appointments. You can look at your results, your test reports, your imaging reports. You can message your team. And if your doctor's out of town, somebody's going to pick up the message, which if you're looking at email, maybe not so much. And you can get your medication refilled in a very smooth and seamless way. There's some problems, though. Not all your records go on there. Some of the labs are delayed in being posted, and some type of notes just simply are locked away from that. So genetic test results and psychiatric results may not be something that will ever go on the patient portal. And so you need to not assume that everything will be there. How do you bring your information with you? Well, you can wear it. There's some bracelets that have a USB drive that you can load your information on. That's also a medic alert. The only problem with that is you got to update it and upload everything on it. Or you can hang one off a keychain, something of that fashion. But I highly encourage medic alert bracelets, because you never know when something may happen. You could get hit by a car and go into an emergency room and no one there will know what your medical history is. There's a wallet page that you can fold up and stick in your wallet. This is on the Myotonic Dystrophy website that covers information about what an emergency room would need to know about myotonic dystrophy. And then my favorite is just an index card. This is my favorite thing. If someone pulls an index card out of their wallet, it's got their med list, it's got their allergies, it's got their primary care doc, it's got the stuff I need to know. And it gets updated, but it's very low tech. And if you have that in your wallet and you get hit by a bus and you come to the ER, believe me, we're going to go through your wallet, because we want to know where your driver's license is and where your insurance card is. And if this is right next to it, then we're good. We've got something. So I really like just a piece of paper in your wallet is very helpful. And then there's a lot of online options. Different healthcare plans will try to aggregate your medical data for you. There's some apps that you can download onto your phone or your laptop, but you do have to import all the data into that and keep it up for it to mean anything. And then your phone, there's some different things that you can use on your phone. And one thing that I encourage is what these guys are doing. Take a photo. Get out your insurance card, get out your driver's license, get out anything that you need, like if you've got a pacemaker and you have that wallet card, photograph it as well. So, and have your family members have a copy, so that if you're in the ER, they can text it or forward it to whoever's in that ER so they know what type of medical device you have, whatever. So that's another way of backing up your data. And then your legally authorized representative. You do legally have someone who is your next of kin, who you will go to if you can't answer a question, and there's a legal order that occurs in. It might be, the first one is your spouse if you're an adult, and then your parent if you're a child, or an adult child if you're an adult. And so anyway, there's an algorithm that we go through, but once we find that person who's the legal next person, we have to ask them questions. And so I encourage people to say, pick a legally authorized representative. It could be one of those people, but it does not have to. But you need to speak your mind to them. Tell them what you want. If you have preferences about advance directives, if you have a living will, they need to know what that is. If it's sitting in a box at home under your bed, no one is going to know what your living will says. You've got to share that with your doctor and talk to your family members. If you have made preferences about not wanting to be intubated or resuscitated, talk to your family about it so that they know what you would want. Because we don't, as doctors, don't want to do something to you that you don't want done. So when you're in the office and you get an EKG and the tech is there with that beautiful pink paper scrolling out with the trace of what your heart is doing, ask them to print off another copy for you. And if they're like, oh no, we don't have enough paper, say, well, can I get a copy of that one? And take it home with you from the office. Stick it in your binder or your folder, however you organize things, because this is important records. And then when you go, bring all your medications in a brown bag. Say, these are the ones that I'm taking, these are the ones I'm not, and these are the ones I need refills on. And that will make that go quickly. Oh, herbal medications count too. Vitamins count too. Bring it all. And then if you're going into surgery, make sure your heart visit, your lung visits are up to date. Talk with your surgeon about your myotonic dystrophy. Talk to your anesthesiologist before your surgery. Ask them, what are you planning to do with my anesthesia? What about my breathing? What about saliva? What about my heart? What if I have a complication? What are you going to do? It will make them think about it. And then rehab and prehab. So be aware if you have a surgery, it might take you longer to get better, a little slower to recover. There might be a new or a different baseline, not quite back to where you were before, but we want to get you back to as strong as you were before. And I highly encourage, if it's a scheduled surgery for what we call prehabilitation, try to get as tuned up as possible beforehand. And then surgery plan, how long am I staying, where will I be, when do I go home, what are we doing with pain management? And then I wanted to describe delirium to you, because this is something that can happen in the hospital, and it's something that you as a family member can point out, this is not how my family member normally is. This is different. And this is a really important red flag, because if someone has delirium, it tells us that there's something important wrong, and we need to figure out what that is. So if you see someone after surgery and they're not back to their normal self, and the team isn't aware that that's not their normal self, let people know. So if they're confused, not behaving normally, thinking normally, if they're excessively sleepy outside what is normal for them, if they're hallucinating, this is something to talk to the team about. And then a lot of the resources are on the MDF website. And I think that's it. We have a breakout session with PT this afternoon. They'll be able to answer more questions.